Hello all. The third section discusses the characteristic of the public health approach. There are several unique features of public health. These include underlying the social justice philosophy of the public health, inherently political nature, dynamic, ever-expanding agenda with new problems and issues being assigned over time, linked with the government, grounding in a broad base of biological, physical, quantitative, social and behavioral sciences, focus on prevention as a prime intervention strategy, and finally, uncommon culture and bond. First, I will pay your attention to the social justice philosophy of public health. Social justice has always been a prominent concern of public health. It concerns the complex intersections of social justice and public health, directing the health equity issues that are still a goal we have yet to achieve. Inherently political nature. There is no doubt public health practice and politics are closely linked. It is impossible to split up our social, economic, and environmental conditions from the political agendas, decisions, and action. The third feature is dynamic, ever-expanding agenda with new problems and issues being assigned over time. The public health agenda have changed with time. Prior to the 90s, the primary issues addressed by the public health were infectious diseases and related environmental risk. After the 90s, the focus expanded to include different problems. For example, in the middle of the century, chronic disease prevention and medical care were considered in public health, and later, substance abuse, mental illnesses, teen pregnancy, long-term care, and other issues fell into the public health. It is evident that there is a link between the government and public health. Two general strategies are probably available for governmental efforts for public health. The first strategy is that governments can establish and modify public health policies that influence health through social and environmental conditions. The other is that the government can provide health programs and services designed to meet the population's health needs. Public health is an interdisciplinary field. Generally, 5 basic sciences are discussed in public health. Those are epidemiology, biostatistics, environmental science, management and behavioral sciences. These constitute the core education of public health professionals. Public health focuses on the prevention of disease and health promotion rather than the diagnosis and treatment of disease. Prevention activities are typically categorized by 3 definitions: primary, secondary, and tertiary. The last feature is the unique bond and sense of mission that links its proponents. Public health professionals include anthropologists, sociologists, psychologists, physicians, nurses, nutritionists, lawyers, economists, political scientists, social workers, laboratorians, managers, sanitarians, engineers, epidemiologists, biostatisticians, gerontologists, disability specialists, and other professions and disciplines. All of these professions and disciplines are essential for public health programs. Analyzing the determinants of health of the population and the threats it faces is the basis for public health, and awareness of the key characteristics of the public health approach is important. Thank you. See you in the next section.